Namaste to all of you. Today I am not going to talk about any disease in particular, but a very interesting topic for those who want to start their own clinic, their own practice. You see, after following 4 years of diploma course by ISRA, you must be excited to start your own clinic. And it's our wish that you should get success in that. That's why today I'll be giving you a few tips based on my experience of 40 years of clinical practice, clinical experience, and that I want to pass it on. So first of all, the factors what helps you to have success is that you should be able to diagnose. A right diagnosis gives you the right result. But we are fortunate that a lot of patients, what you will be getting, they are already diagnosed. And they are diagnosed, then it's easy to treat them. That's not a big gain. If someone has got rheumatic problems, we know in Ayurveda that what type of Ayurvedic medicines we should be giving. If someone has got diabetes, then we know what type of Ayurveda medicine should be given in diabetic cases. So that's not a big game. Because patient is already diagnosed, then you can help them. So what really in the practice we want to get success in is a very, very big group of patients. They come to you and they will say that they've been everywhere. They've been to their GP, they've been to specialists, they've been to acupuncturists. Nobody could treat them, and now he is here by you, and how you will treat them and how you can make him healthy, happy, that's a question. To treat a patient, we have to develop a sort of attitude. The very first and important attitude or approach what one should develop or one should have is that one person is helping the other. So this is very, very important. So you should develop within you that this is a project. Patient of yours has come with the expectation that you will make him healthy, and it's a sort of project for you. Your approach should be open. If you don't know, you don't know. But if you don't know and you are ready to investigate, to ask your colleagues, to go through the books, to go through your notes, to go on Google, to go to study further for that problematic. So that's what I'm talking about, the attitude, that there should be will to treat that patient. You should be doing your best because patient has come with an expectation. Then second thing, what very, very important is that you should be updating yourself. You are never a master. Therefore, you should join one or the association where you are working. In Holland, we have got different association, ANFAG, that FEBAG, and there are so many associations. They are professional association. They have got continued educational program. And if you are a member, then you can ask them about your queries, but also if you are regularly in touch with your colleagues, then you will come to know about their experiences, what you can use in your clinic. Then whenever there is patient, you have to have a sort of rapport with the patient. You should develop a relation with your patient so that patient uh, is convinced that you are interested in treating him. You are listening him. Listen to your patient thoroughly. He is not saying for nothing. He has got a message to convey. Perhaps he doesn't have the words, the proper words, but he wants to tell his feeling, and feelings don't have words. And it's your duty to gather what he wants to say. The patient should feel that you are actually his partner in journey of his health. So that at least we should be having the approach towards patient. And now in practice, it's very, very important to maintain medical records of your patients. Which type of diseases he have had in past, what is his hereditary problems, if there are any problems what comes in the family, like high blood pressure, diabetes. So you must maintain his medical history. So history taking is an art. You should be asking questions that should be relevant, that you get information from those questions. It's not just like where you are living and how old you are, but if you are asking any question, there should be logic behind. And then we have to know the pathogenesis, that is the etiology of the disease, that how this disease has developed. We have learned in Ayurveda samprapti, pathology of a disease. In the books, it's always written etiology from the very beginning. For example, if patient doesn't sleep well, he will develop vata. If vata is increased, he will be restless. If he is restless, he may feel anxiety. If he feels anxiety, it can develop into the depression. So it's a process from the very beginning how it has developed. But no patient has come to you in a situation where he is now facing problems of depression. Now we have to go back, that how it started. So it's always retrospective. So retrospective means we have to look backwards, look back at the events that took place in the past, in the development of the disease. So you should learn to think backwards. So he has got depression, how it started. In last month he could not sleep well, or there was any problem financially. So you must try to gather the link of the events, what had happened in the last. And that helps in the management of the disease. So then we must know disease where it is localized, which system, which part of the body, which organ is involved or sick, and try to get information that why it is. How come that this organ is not functioning well? So in short, I've said that if patient is already diagnosed, then treatment is easy. But your skill is when not other therapies can diagnose the patient, and patient is suffering and he has come to you, that he is not happy, he doesn't have energy, he has got everywhere pain. So then, how according to Ayurveda we should be checking that patient? So first of all, what we have to do, we have to see that what type of food he takes, because food plays important role. we should see what type of food your patient takes. So food is what gives you calcium, magnesium. There are a lot of patients, they are not taking milk or milk type of proteins. Then you know that the patient is not taking sufficient calcium. He is vegetarian. He doesn't take meat. So he is not taking proteins. So there are a group of patients, they are nowadays vegan. They don't take anything from the animal source. Anything made of milk, anything made of meat, they are not taking. I must tell you here that vegetarian food, taking only vegetables or fruits, this is not the complete food. So if patient is having pains, then I know that the patient of mine is not taking enough calcium, and calcium insufficiency, that is one of the major reasons behind the pains. So you can give him paracetamol or any painkiller, analgesic tablets, but that's not the approach what we should be having. We should correct his food. You should make his diet chart so that he is having enough calcium. And then it's also possible that patient is not having enough iron. So that's also with the vegetarian people. As vegetarian people, they are having less vitamin B12 and also less iron. So then patient is taking B12. So if we can accommodate that with the food, that would be better. And not to forget, it's not always that what we are taking is being absorbed. You can take calcium, you can take milk products, but if vitamin D3 is not sufficient, it's not being absorbed, then it's also not going to help. So D3 we get from the sun, but we are not having enough sun. So vitamin D3 we should be having. So I won't be giving patient any analgesic in this case if I find that patient is not having a right combination of the food, not enough calcium, not proteins. So then I will be supplementing that through his diet. So then second approach is that we should know what type of lifestyle patient is having. Patient is sleeping well. Then what type of work he does? Is he doing physical job? Or is he doing totally nothing? So if you are not using your body, then also your muscles are not trained. So with little efforts, you can get pains. But if you are doing too much physical job and your diet is not good, then obviously someone is going to get discomfort in his physical movements. He will be facing pains. He will be having pains. So again, I am not going to give him paracetamol here. I will be giving him rest and physical activity, balance in between. There should be balance. If he is working 18 hours a day, it's not good. If he is sleeping 18 hours a day, it's also not good. So what type of job he is doing is very, very important. So there are a lot of jobs where patient has to stand whole day, shopkeepers, for example. So that way they have to take stocking. So patient, those who are standing whole day, they can get varicose vein because pressure of body weight whole day on the legs. They need, a sort of legging, long socks, tight socks, stocking. Then comes very, very important factor. we should be knowing about your patient's behavior, way of thinking, and what type of mental status he has. Having anxiety? Is he sorrowful? Is he sad? Is he excited? If recently something has happened, any loss he has occurred, financial loss, emotional loss. So these all factors are what we can't measure in the laboratory. We can only feel. And if you are not happy here, if you are living with anxiety, sorrowful, sad, you have occurred losses, you can't be happy from inside. And how your body can function optimal. And we people have developed a word when we are not feeling happy or okay, then we say that I want pains, I don't have energy. So it's a totally different type of words what we are using for totally different type of problems. So patient is not happy, but he's saying he's not having energy. He has got pains everywhere. So that's what mostly it happens in the practice. And as a practitioner, we should be able to differentiate that. So we must know mental status of a patient. So in any case, in this type of situation, he's living with stress. Then paracetamol won't do anything for his pains. So we have to give him counseling. We have to have a good session of counseling to make him understand. So if patient had any serious problem, they would have detected that in hospital, and you can treat that with Ayurvedic medicines. But the question is, the diseases what is not detected, what are in very beginning stage, like so many women, they are having hypothyroidism. We know that patient with hypothyroid, he will be having body pains because his or her digestion is not okay. And there is ama forming. And ama is what is the reason behind the pains. So here I will be treating his or her digestion system. We must check if thyroid is working properly. So you must inquire about the thyroid function, his hunger, his appetite. If you see further that if patient is having any fluid retention in the body, fluid retention, you know that your heart has to work extra. So attention should be given. So one should take a serious note of that if there is any fluid retention in the body. Then very, very important thing what I want to tell you, that in beginning of any infection, any fever, there is always pains in the body. And there are so many unidentified infections in the body because of the viruses. And pain is always a complication of the infection, certainly of the virus infection. So we should give attention to the pain that way, that it can be perhaps because of virus. So you see, a lot of diseases are with virus, very famous here. There is CFS, chronic fatigue syndrome. So a lot of virus problems are with the liver also, liver function that, and nowadays corona or other virus infections, influenza. So viral infections in our body that is also the reason behind the pains. So giving paracetamol or any painkiller analgesic is not the right approach here. So we should give full attention to lifestyle, food, mental status, diseases, what needs attention, but it's your duty. And if there is an infection, there is a slightly temperature raised. Patient is having fever, and in fever is always there are pains. So we have to see that if there is chronic infection, then one more reason behind pain and not feeling well, always tired, that is that cancer. So as a practitioner, should we open this, all the factors you have to check before giving medicines. So you have to develop an attitude to see each and every aspect. Then also there is one more factor, weakness of the nerves. Mostly this is a complication of chronic diseases like diabetes. So then you must inquire your patient. If he is having diabetes so many years, then with due time it has developed to the neuropathy. His nerves are weak, and then the nerve weaks can give also pain. Then last, what very, very important is, there are a lot of medicines what patients are taking for years that can also give you a sort of pains and not feeling well, weakness. Those medicines are like beta blockers and statins. So if patient is taking these medicines for years, then he must consult his doctor or specialist that he is having pains. It might be because of the statins or beta blockers. So as a doctor, as an Ayurvedic practitioner, this is your duty to see patient with this point of view. So medicine only won't be helpful in this. So we must be giving him food, lifestyle, way of thinking, strengthening his mind. And last what I want to say is the selection of medicine. There are 10 herbs for one disease. Why 10? You must see in your practice whatsoever you have learned that which one is the best. What is the drug of choice for that? If patient of thyroid, we have got 10 medicine, but which one is the best? Patient of heart, there are so many medicine, but which one is the best? So selection of a herb, that is what you have to select. Combination. Then selection of herb and sure that proper dose is being given. That's what a lot of Ayurvedic doctors, they make fault by giving not proper dose of the medicine. If proper dose is written 3 to 6 grams 3 times a day, then that should be given. Mostly the dose of Ayurvedic herbs are in grams, that 3 to 6 grams 3 times a day. And it's advised 3 types of different herbs. That means that 3 times 3, 9 grams in morning, 9 grams in evening, 9 grams at night. It's too much. Patient can't take. It's difficult for the patient. So then he doesn't take that proper dose. He will take perhaps a half or 1 time a day. So that's why we have developed tablets of the extract. That from 1 gram of the powder we have got 100 milligrams. And from 9 gram or 10 gram of the powder, we have got 1 gram of the extract. That's easy to take. So giving 1 tablet in morning, 1 tablet in evening is sufficient. So what I want to say that the dose should be checked. So dear friends, I hope that with this information, I have given you a few tools to start your practice. So my best wishes are with you. If there are any queries, just give me a call, contact me. Thank you very much.